Welcome back to the channel. Today we're diving into a key topic in inflammatory joint disease, spondyloarthropathy, or SPA. This group of conditions affects much more than just joints. It's a complex mix of genetics, immune system issues, and inflammation that can involve many parts of the body. These conditions include ankylosing spondylitis, psoriatic arthritis, arthritis linked to gut diseases, joint problems that follow infections, and types that don't fit neatly into a single category. They may seem different, but they share a lot in common: similar symptoms, family patterns, and imaging findings. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. So what causes them? We don't have one answer, but there's strong evidence that genes, especially one called HLA-B27, play a major role. The immune system is also involved, and in some cases, things like infections may trigger the disease. There's also growing research on how the gut and joints may be connected, especially in people with bowel-related joint problems. Now, let's talk symptoms. One of the key signs is ongoing back pain that gets better with activity. Inflammation in the joints where the spine meets the pelvis is very common. Joint pain in the arms or legs tends to be uneven and affects just a few joints at a time, often in the lower body. There's also inflammation where tendons attach to bones and swelling of entire fingers or toes, sometimes called sausage digits. A strong response to anti-inflammatory medications is also a big clue. As for HLA-B27, this gene shows up in over 90% of people with ankylosing spondylitis and is common in other types as well. It's not just a risk factor, it can also help us predict how the disease might develop, including earlier onset and more severe symptoms. But these conditions don't just affect joints. In psoriatic arthritis, skin and nail changes are often part of the picture. In people with bowel diseases like Crohn's or Colitis, about 1 in 5 will also have joint issues. Some of these joint problems match the ups and downs of bowel symptoms, while others don't. And eye inflammation, especially sudden, painful flare-ups in the front of the eye, is also common, especially in people with that HLA-B27 gene. Family history is important. If someone in your immediate family has one of these conditions, especially if they have the HLA-B27 gene, your risk goes up significantly. Doctors use classification systems like Amor's criteria to help recognize these conditions early. It's a point system based on symptoms like back pain, joint swelling, skin or eye issues, family history, gene testing, and response to medication. A score of 6 or more suggests SPA. But before making a diagnosis, other possibilities have to be ruled out, like rheumatoid arthritis, widespread muscle pain, regular back strain, or joint problems after infections. Testing includes a detailed medical history and physical exam, especially to check for signs of tendon or eye involvement. Blood tests look for signs of inflammation and check for the HLA-B27 gene. X-rays can show changes in the spine or joints, but MRI is even better for spotting early damage, especially with special scan settings designed to show inflammation. Treatment starts with anti-inflammatory medications, which often help a lot. If symptoms continue, medicines that block immune system proteins like TNF or IL-17 can be used. Some drugs help more with joint problems in the arms and legs, while others work better for back or skin symptoms. Steroid shots may be used for short-term relief, and regular exercise or physical therapy is essential to stay flexible and active. The good news? With early treatment and the right approach, people with SPA can live active, healthy lives. But without care, the condition can lead to stiff joints, limited movement, and even issues like heart disease or weaker bones. Thanks for watching this deep dive into spondyloarthropathy. If you found it helpful, give us a like, subscribe for more easy-to-understand rheumatology topics, and leave your questions below. We'd love to hear from you.